Hey everyone, this is Laura back with the Eden Alternative. Welcome to Eden Alternative Live. I am incredibly excited to hang out with two of my favorite people today. Our guests are Dr. Peter Reed and Dr. Jennifer Carson. Just a tiny bit about them, and then I'm going to let them take it from there. Dr. Peter Reed is the director of the Sanford Center for Aging at the University of Nevada at Reno. And Dr. Jennifer Carson is the director of the Dementia Engagement, Education, and Research, also known as DEAR program, also at the University of Nevada at Reno. And so just kind of a fun reflection on why we're here together today. Fun because memories are always more fun, right? But the truth is it started at a really stressful time for all of us. And so if we were to dial back time to about a year ago, at the beginning of pandemic life, I remember having a conversation with Jennifer over the phone about another project, and she and Peter, who are partners in work and life, were all abuzz about something they were up to that they felt really inspired by because they had a really important opportunity to make a difference in the lives of elders in Nevada during the beginning of the COVID-19 pandemic. And so that's what we're here to talk about today is the fruits of their labor during that time, which was remarkable because it happened at warp speed. This is all about Nevada Can rapid response. And so I'm going to let the two of you tell us a little bit more about you and how all of this wraps into what Nevada Can rapid response is all about. And how did you pull it off so quickly?
You want to start?
Well, do you want to introduce yourself first, and then I'll talk about Nevada Can?
Thanks. So thanks so much, Laura. It's really great to be here with you. Just a little bit of fun to our intro. Peter and I actually met and fell in love at the Eden Alternative Conference in Grand Rapids.
That's right.
And after that, we got married, and I've been on faculty at the University of Nevada, Reno. We're both on faculty there, and I launched the DEAR program. And I've been working in the field of dementia support for about 30 years as a professional. I'm also a family care partner. And so it was great to, if you're going to be stuck at home with someone, how great to be stuck at home with my husband and favorite collaborator.
Yeah, thank you so much, Jennifer. I had forgotten, Laura, that we did meet at the Eden Conference, and we joke every time we go back to the Eden Conference that it's our Eden anniversary. And so that's always a lot of fun. That was 2012, I think.
Hey, I was there.
You were there. It was Eden's Got Talent that really sealed the deal. Anytime you can work together and play music together, then you know it's gonna be a connection that sticks. So I have a similar background in terms of the length of years, but have done different kinds of work. You know, Jennifer has really worked in a variety of different care settings throughout her career, and is a researcher and an advocate and a change agent. And I have not worked in care settings per se, but I am also a public health gerontologist, as is Jennifer, and have worked in a variety of different organizations, mainly nonprofit and university organizations focused on aging, long-term care, dementia, and culture change, and really bringing together, sitting at the intersection of research, practice, policy, and leadership, I think, which are all important qualities that kind of define my career. And it was these qualities of being public health gerontologists and leaders that brought us to launch Nevada Can. And so it's quite a story, but as you can imagine, and I think it actually was almost exactly 1 year. Is today the 16th? It's been a long day already.
Yeah.
So I know that it was on the 17th of March last year when the University of Nevada, Reno told us to go home and don't come back. Yeah. And so suddenly you had the two of us, since we're married, quarantined together. Now, things had started looking pretty dicey, you know, in the couple weeks leading up to that. And I remember the week before, on, it was a Friday the 13th, I had sent out a message to the entire network of the Sanford Center for Aging, which is a university aging center, but primarily functions as a community-based aging services organization. And I had sent out a communication to our entire network saying, we are no longer doing any in-person programming. We're going to work quickly to bring everything online. And our entire team had essentially done that by, within a few days. And so we were prepared. Our whole team was online and up and running. And then Jennifer and I got quarantined together. And for the first several days, we were honestly just freaked out. What is going on? And we saw very clearly the impact that COVID was having on elders, and recognized what I think at that time, at least maybe some others didn't see as clearly, that not only was this a public health crisis and an economic crisis that was unfolding, which was widely publicized, but this was also going to be an aging services crisis. That there were small aging service organizations, with funding from the Older Americans Act and through their AAAs all over the country, that had struggled for decades to meet the needs of a tiny portion of the elders who are in need in the community, and that suddenly and essentially all elders were homebound.
All elders, everyone overnight. 65 and over, overnight, stay home.
Yeah, and so Jennifer and I brainstormed for maybe 2 or 3 days and came up with an idea, which was that not all organizations, can continue to do everything for everyone in the way that we often try, but that we needed to have a really tight set of goals and objectives centered around enabling all elders to stay home, stay well, stay safe, while they stay connected to essential daily needs, to social engagement and social support, and medical and social work services, or telehealth kinds of services. And so we reached out to the director of our state unit on aging. Her name's Dena Schmidt. She's the administrator of the Nevada Aging Disability Services Division. Called her up and said, look, this is what we're thinking about. And she said, oh, we've been struggling with what we can do as well. This is great. Let me bring the leadership team together. So she brought that team together. We then recruited another colleague of ours. His name's Jeff Klein from Nevada Senior Services in Las Vegas. And within 2 weeks after that meeting, we had developed and launched the Nevada COVID-19 Aging Network Rapid Response. We had a very tight program plan. We had created a website and launched it. We had gotten approval from the governor's office. Governor Sisolak and his COVID task force sent out a press release announcing this. And we essentially mobilized all of the different community-based aging service providers around these 3 tight objectives of making sure people had food and medications delivered to their house, that they had virtual social support available to them, and that they had telehealth services at their disposal as well. And so we launched that through the website, which was able to receive people's requests for support and then triage them to 3 different action teams, 1 action team for each of those different areas that I mentioned. Right. And I led the telehealth action team. Jennifer led the social support action team, and our colleague Jeff Klein led the food and medication delivery action team. And then, that was by April 1st of last year, after what was honestly in our home, 2.5 weeks of nonstop perpetual planning meetings.
And was there sleep part of this equation at all, or?
We'd sleep once this was launched, maybe.
Yeah.
But the great thing about these action teams that Peter described is that each action team is comprised of multiple partners from across the Nevada Aging Services Network. And so, for instance, the social support action team that I support, what we did was really leverage as a starting place the dementia-friendly Nevada network partners, and which is dozens of organizations, and then we continue to reach out to other aging service and social service organizations to see who wants to join us in a shared effort to meet the social support needs of homebound elders. And we're able to bring together a team of over 30 aging and social service organizations working together to provide volunteer-hosted virtual social support. Peter took a similar approach, building a telehealth action team of multiple providers. Jeff Klein at Nevada Senior Services did the same thing, with the Food and Medication Action Team, really leveraging the county senior service agencies and pop-up food delivery organizations here in Nevada. We have a wonderful pop-up from this COVID pandemic called Delivering with Dignity. And they really look to mobilize local restaurants and other not-for-profits and helping to deliver meals to the front doorsteps of elders' homes. And so each of these action teams had multiple partners, and we're really grateful to the leadership of Nevada Aging and Disability Services Division under the leadership of Dena Schmidt for really helping convene all three of these action teams under one umbrella, under the Nevada CAN umbrella, and helping us create that single point of entry so that any elder or a person who cares about an elder can easily make a request for services either online through a simple form or via text to Nevada 211, or simply by just picking up a phone and calling 211 and asking for assistance. And so we wanted to, the aging services landscape in Nevada, probably like every other state, is pretty complicated. And we didn't want people to have to try to navigate that landscape during the pandemic.
No way. Yeah.
Create an easy interface, a quick way for people to ask for help, and a quick way for us to triage those requests and to meet those needs within 24 to 48 hours.
I visited the website briefly today, and totally elegantly simple, completely unintimidating. And so I was like, oh gosh, they just really nailed making this something that was user friendly. Because I know how I can feel at times when things aren't stressful or I'm moving quickly and I access something like that and it's just too complicated. I don't want to mess with it. So I can only imagine, dial back a year ago, people are like, what's happening to me? How am I going to get my needs met? So, kudos to you. What strikes me is your ability to be mega conveners. That's not a small task, right? Here you created this beautifully, elegantly simple thing that, has impact, but in order to get there, you had to bring all these pieces together and quickly. And I'm just curious, what was the vibe, the teamwork vibe, as you were engaging all of these different organizations in this process?
Amazing. I have always believed, to quote Margaret Wheatley, that no matter the problem, community is the answer. And we were able to leverage the networking community that Peter and I have enjoyed being a part of for years, and have helped to cultivate. And so the total Nevada CAN effort engages more than 100, maybe upwards of 200 different partner organizations.
I wouldn't even know.
There's so many, but we weren't going from 0 to 100 when the pandemic hit, because we already had these collaborative networks. For example, the Dementia Friendly Nevada effort, we launched that effort in 2017. And we've been working collaboratively across the state to really improve the culture of dementia support for years. And so we were able to really leverage the strengths developed, the strengths of partnerships developed through that network as a foundation for the NEST Collaborative, which is the name of the program. It's the social support innovation for that particular action team. We call it the NEST Collaborative. NEST is an acronym for Nevada Ensures Support Together, because that's exactly what we're doing. But we were so grateful that we had worked collaboratively in Nevada for years prior to the pandemic, so that when we really needed to leverage those partnerships and when we really needed to come together as a statewide network of professionals, we had the capacity and the collaborative muscle to actually do it well. And so, it was a major convening of the partners. We expanded a lot of our networks and partnerships, but we were building on a really solid foundation that we've enjoyed for years in Nevada.
But
So
I think,
amazing. Go ahead.
if I could, I think one of the things as well is that there were a couple things happening there in terms of the structure of aging services in Nevada, and just given kind of the sensationalism of the beginning of the COVID pandemic. Right. And so, I mean, one of the things is structurally, Nevada does not have area agencies on aging. We just have a single state unit on aging that serves as the de facto area agency for the entire state. And so, therefore, all of the community-based provider organizations are essentially grantees of the state unit on aging. So when we got the state director on board with this, and when she became, really an integral part and a lead in terms of Nevada Can, she had the ability to host. And I remember during the first week before we launched the website, as we were rolling this out, we had 3 informational meetings for essentially the Aging Services Network in Nevada. And I think there were about 100 people on each of those 3 calls. It was the same call 3 times during 1 week with 100 different people each time. And it was Dena Schmidt saying, we know you're concerned. We know you're unsure, what we're going to be able to do. But this is what our state's response is going to be. And we want you to be a part of it. And so that message got put out to people at a time of genuine uncertainty. And I think that made a big difference.
Oh, yeah.
I will say there was some hesitancy and some resistance by some of the organizations that were doing similar kinds of things. So there might be an organization that says, oh, well, we're already giving social support to elders, so you don't need to create this new virtual social support initiative because we already do that. And our response, again, to the sensationalism of the time was, that's true. You're doing a great job providing social support, to the 100 or 200 people that you serve every year. It's like, but what happens when there's 450,000 people that need that kind of support? Like, we have to work together.
Got to work together.
Bring all these organizations together. Now, that level of need never materialized, but that's what we were planning for. Do you know what I mean?
Yeah. Well, but you had to be ready for that. We had no idea what was going to happen, right? So being prepared, everything. Kathy Hagen is in the comment box, and she has a really great question. She wanted to know, how did people find out about CAN? What was your outreach protocol or plan?
So first, we shared information, contact information for how to connect with the Nevada Can effort through informational flyers that were actually print flyers that went out through the Nevada Aging Services Network, so that every aging service provider could print off and share information in print with the clients who they usually serve, in addition to other elders in their community. And then Dena Schmidt at Nevada Aging and Disability Services Division worked with her communications team to develop a PSA about Nevada Can. Very simple, very clear. If you are 60 years and older and need services, if you need food and medication, if you need social support, if you need healthcare, or other things, to connect, call 211, text 211, or visit the Nevada 211 website to connect with Nevada Can. The PSA was even shorter than what I just described, and so the PSA went out across the state. And of course, different newspapers picked up on this story and shared that information. And then really wanting to make sure that we're connecting with some of the most vulnerable Nevadans, we have sent out print flyers about Nevada Can, and especially about the Nest Collaborative, which provides volunteer hosted virtual social support. We sent it out to over 20,000 Nevadan homes through home delivered meals through the Food and Medication Action Team. And so gradually, we just kept working to get the word out, and we're still working to get the word out, and trying to ensure that everyone knows that this effort exists. And maybe we'll talk about a little bit later on that the effort has been so successful that we have built that pathway to future sustainability. Yeah. So even though we're hoping that COVID will soon be in the rear view mirror, the wonderful infrastructure that the state of Nevada has built in response to the COVID pandemic is here to stay. And so we will continue to communicate to Nevadans that the Nevada Can effort is here, and that we have teams of volunteers and aging services professionals ready to be mobilized in meeting their needs. So yeah, communication is always a challenge. So we try to use multiple different outlets to share that message.
And I should have mentioned in the overall overview, I mentioned the action teams for food and medication, social support, and telehealth. But in the plan that we worked from, we also had an action team specifically for communications and outreach. And that was Dena Schmidt's responsibility. So as Jennifer said, she worked with the communications team in the state agencies, and they did press releases and PSAs and worked to send out email communications and social media. And just a whole robust thing. Actually, one thing I really enjoyed, and you can check this out if you go to their website, but there's a local television show called Aging and Awesome here in Nevada. And it's a weekly television show. Again, it's called Aging and Awesome. And Kai Sisson is the host for that. And he invited us to do an episode on COVID and aging. And we had about a 15-minute segment describing Nevada Can.
That was in early April.
That aired, last April, and so that was an opportunity for us to really give the phone number 211.
And we see that on Aging and Awesome with updates about the Nest Collaborative.
That's perfect, because one of the questions here from Evie Kugelman is, did you get any media support? So that answers that question, right? And just one other question that I think is, worthy of pausing and responding to is Laura, I think it's Ollinger, I hope I'm saying your name correctly, but she wants to know how many people are using the services. Do you have any metrics on this right now?
Yeah, sure, you go for it.
Yeah, so with the different action teams, the way that we're tracking the data is that we look at all of the related services being provided by the partners who are in those action teams. And that's a different number from the people who have specifically requested help through the Nevada Can portal, because the service delivery is bigger than just the requests for help, right? Because we identify all kinds of people in all kinds of different ways. And so I guess I'll save the biggest for last, but I know from the telehealth action team, and this is tracking data from April 1st through the end of February, because I put together a monthly report. Our partners, who are part of what is now called, it's the innovation to come out of this, is now called the Nevada Geriatrics Telehealth Collaborative. And that collaborative and its partners have delivered just over 14,000 telehealth visits since April 1st. The Nest Collaborative, the virtual social support innovation, has delivered, I think, over 3,000 volunteer-driven hours of virtual social support to folks. And the food and medication action team, through Delivering with Dignity and the network of county services agencies, has delivered over 300,000 home-delivered meals across Nevada since April.
Oh, I mean, take a breath there. Like, let's talk about impact, shall we? I mean, kudos to you and those who joined you in this effort, to know that some basic needs that might not have been met were met, with flying colors. That's an incredible outcome. I'm glad we went there.
Well, in addition to the services provided by the 3 action teams, Nevada Can also makes referrals to different aging and social services organizations for other services. And so, for instance, if somebody needs help with housing, or maybe they need some legal assistance, or maybe they, transportation is always a big issue.
Economic relief.
Economic. So when people are completing the Assess My Needs form for Nevada Can, if they need help with something that doesn't fit into one of our 3 action teams in the state of Nevada, their trained and qualified case managers then triage those referrals to an appropriate local aging or social service organization. And I don't have the metrics on that number of referrals, but I think that it's over 3,000 people who have made requests for additional services.
Mm.
It's so we have action teams for those priority areas that we think are really essential to people living their daily lives. And then additional services are triaged through our through Nevada Aging and Disability Services Division.
Yeah, and specifically those additional services. So as Jennifer said, there's the 3 action teams: food and medication, social support, telehealth. Anything else goes through our state unit on aging with the system that they use called the Aging Disability Resource Center, which many of you are familiar with because you have those in your states. Ours is called Nevada Care Connections. And so they have their case managers that help connect people with other community resources. But when they get, and actually all of the requests go into Nevada Care Connections and 211, and then get pumped out to our action teams if they fit within our scope.
I see. Fantastic. Again, the convening is mind-blowing. I want to connect some dots here real quick. Both of you have a background in, person-centeredness, person-directedness in terms of approaches to care, right? So how does that factor in? How did that shape the way the rapid response rolled out?
Well, number one, Peter and I have spent our careers really being champions for person-directed and relationship-centered approaches, and so we weren't going to abandon that important foundation in our lives during the pandemic, but instead really build on it. And so Nevada Can was really developed to help each elder self-determine their needs during the pandemic. And so either the elder, him or herself, or a person who cares about elders can go on and request the services they want without assumptions being made about what people need or might desire. And so it is, by design, a person-directed initiative. And secondly, knowing how important it is to always work in partnership with the people we serve, we were not going to abandon that value to launch a rapid response, but really harness the value and importance of partnerships to develop the response. And so we worked with a group of elder advisors from Dementia Friendly Nevada, people who are living with dementia, to develop the Nevada Can plan and all aspects of our work. And so we had elder advisors provide input on what are those essential priority areas that we need to serve. How do we develop an age and dementia friendly website? So I'm glad that when you looked at it, you thought, hey, this is great. It's simple, it's clear, it's easy to use. That's because it was developed in partnership with elders. And
what a concept, yes.
Exactly. The first draft of the website probably did not look that way, but we worked with people living with dementia to develop the website, to develop the form to request assistance, and then to develop the specific programs that we're providing. Especially with the social support action team, our program innovation, the NEST Collaborative, has been developed in partnership with people living with dementia and other elders every step of the way. So they've advised us which programs they thought would be best for us to offer, how often those programs should be offered, what the content of those programs might include. They've even helped us with all of our volunteer training, developing their own training as a component of our volunteer training. So elders have been essential partners in the development and success of Nevada Can. And I think that it's very much that approach, I think, is stems from our work within the culture change movement and our commitment to working collaboratively, to directly engaging the people most affected, to really honoring the wisdom, experiences, and input of elders. and basically at the core, it's all about relationships. Nevada Can is really about relationships, partnerships, and collaboration.
Doesn't surprise me at all, but I'm delighted to hear the details. And I think it's important for everyone, to be aware of the spirit behind the work that you did.
The other thing I wanted to offer, Laura, is that many of our volunteers are elders themselves. And so this was not an effort designed to support just to support the needs of elders, but this was an effort designed to engage elders in helping us meet the needs of elders who may require more assistance. And so sometimes the line between volunteer and program participant gets really blurred. And we love that, because really what we're trying to do is create reciprocal communities of support. That's what it's about. So even our volunteers, we don't approach providing virtual social support, let's say, as service delivery. But instead, we approach it as an opportunity to have a reciprocal relationship. And sometimes that is a multi-generational kind of engagement, and sometimes it's peer-to-peer. But in all cases, it's really about helping people have these reciprocal communities of support, which benefit our volunteers just as much as they benefit the traditional program participant.
No question. By bringing that frame of mind to it, you highlight that everyone's a part of the solution.
Yeah.
They actually can believe you, because you're modeling that. So, and I want to take a moment, that I'm not the only one who's lighting up as I listen to this. I'd love to highlight Evie Kugelman's comment here. Shouty capitals. Wow, this is stunning. So I'm wondering, Meredith, if you don't mind popping that up on the screen so that we can take that in. Yes. So absolutely stunning what you're sharing. And so if I may, I just want to also go back in time for a moment to June 11th, the day that Peter testified to the U.S. Senate Committee on Aging, correct? Subcommittee on Aging. Right. So, you had an opportunity to talk about what you had developed. And I know it was still a young process, but I imagine you were already sharing some of the successes or strengths of what was coming to life through Nevada Can. And so I'm wondering, maybe you want to reflect on how that went down, but also to just give us a sense of what's showing up as the winning features. You're kind of already sharing them. It's a little embarrassing to ask this again, but what have we not covered that, maybe there's some surprise successes that you want to share?
Yeah, so that was quite an experience to be invited to testify in front of the U.S. Senate Special Committee on Aging. It was pretty intimidating, I will say, because they gave me 5 minutes to describe this entire initiative.
He did really well.
And then they asked me questions rotating between a Democratic senator and a Republican senator, and they would go back and forth, and it was just a really interesting and fun thing. And I was really honored to be invited, but to do so as a representative of our larger work on Nevada Can and of all of the partners, such as Jennifer and Dena Schmidt and Jeff Klein. Really what that hearing was about was social support. So the Senate Committee on Aging was very interested in considering the impact of social isolation during COVID and ways that we could keep elders connected to others and maintain their relationships throughout this experience of being homebound, not just in the community, but also, within long-term care as well. And so there were several other presenters who were part of this session. But I will say that the senators were really interested in the work that we were doing and saw, I think really it was the rapidity, or just how quickly we put this initiative together and how quickly we were able to mobilize this statewide response. But in the presentation to the committee really highlighted Jennifer's work, the NEST Collaborative. And honestly, she should have been the one that was presenting that work, because the NEST Collaborative and social isolation was what they were looking for. I just happened to be the one who had been having a conversation with the Senate representative, a month before when they learned about the work. And so I was the one that happened to get invited, but I was doing it on behalf of the larger group.
He represented us so well. We were thrilled.
Yes, he did. Are there any other things that you want to highlight, success, strength-wise or surprise-wise, that maybe other communities can benefit from hearing?
Well, I think one of the things, and this goes back to your earlier question about how this work was kind of grounded in person-directed and culture change values. That's true even within the telehealth action team and the work that we're doing. So the Nevada Geriatrics Telehealth Collaborative, you could imagine, could be very medicalized in its focus and in its approach, right? Could be very deficits focused, but it's not. We brought partners together from a variety of different disciplines. And so, we have telepsychiatry and teledementia assessments and support. There's telesocial work, teleprimary care, teleoccupational therapy, speech therapy, physical therapy. And so there are all of those, but it starts with a comprehensive telemedicine interdisciplinary geriatric assessment. And so the Sanford Center for Aging has an interdisciplinary assessment, as does Nevada Senior Services, our colleague in the South. And so anybody that comes in, they go through that comprehensive whole person assessment first. And so that includes a medical assessment, yes, from a geriatrician, but also a geriatric social worker is doing a psychosocial review, looking at people's living situation. We have a geriatric pharmacist doing comprehensive medication reviews, really looking at everything there is to know about that person, grounded in a specific value that underlies our clinical approach of leveraging an elder-driven partnership. And so we saw that as kind of an evolution beyond what's referred to in the medical settings as patient-centered care, right? That it is genuinely a partnership in which the elder is driving it, that they're the author of their own experience in terms of the recommendations and the care plan that comes out of this, but by taking into consideration the whole person. And I think that may be a surprise for some folks that, you could have a network of telehealth providers that embrace a whole person interdisciplinary approach where the elder is driving the recommendations that come out of it.
I think it's really important to highlight that this was happening when people were freaked out and they were reactionary and there was all this uncertainty, and that it's possible to stay grounded in person-directed relationship-centered practices, even under the most challenging of circumstances. In fact, it strengthens our resiliency, doesn't it?
And we get better outcomes.
Yeah, absolutely. So
Laura, one of the other things that I'd love to share that was a development that wasn't part of our original plan, but has been incredibly helpful, kind of parallel to the Nevadacan effort across the hallway within our Department of Health and Human Services, sits the Division of Public and Behavioral Health. So we have our Aging and Disability Services Division, and then the Division of Public and Behavioral Health. And Dr. Stephanie Woodard from DBPH applied for a FEMA grant to bring to the state of Nevada 40 resilience ambassadors, which is a strengths-based way of thinking about a more traditional crisis counselor approach. And they launched something called the Nevada Resilience Project. And they embedded these trained resilience ambassadors within existing aging and social service organizations in the state for extra capacity to help people who are in crisis. Nevadacan was the beneficiary of 2 incredible Nevada resilience ambassadors. And so that when, for instance, when our volunteers are providing social support, and we have 3 programs, by the way, of social support: 1-to-1 friendly visits by telephone, weekly peer social groups via Zoom, and then we also offer tech support, which is incredibly important, especially now, so you have everyone's kind of stuck at home and online. But sometimes our volunteers would interact with an elder, and they learn that this elder is really having a hard time. They're in a desperate situation. In addition to the friendly visit, boy, they could really use some more skilled counseling or help. And so within the Nevadacan effort, we had 2 full-time Nevada resilience ambassadors that we could make direct referrals to. So that very day that the volunteer is talking to that elder who's in crisis, we can make a referral to our 2 resilience ambassadors, Marina Headwall and Mackenzie Rooney, just as easily as sending an email or picking up a telephone. And they would contact that person, of course, with their permission. They would contact that person immediately to follow up and to really help them with whatever situation they're dealing with. So that was incredibly helpful. that our volunteers had skilled counselors that we could turn to during those times that the needs of the program participant kind of exceeded the expertise or skill set of the volunteer. And so that was a helpful surprise, wasn't it?
Yeah.
Oh my gosh.
Just an incredible resource to have these resilience ambassadors be part of the team. And it, as Jennifer said, there were the 2 that were embedded with us, but then there were like 30 something others embedded with organizations around the state. And they don't just handle kind of crisis calls for people for this one-on-one counseling, but they were also given the tools through train the trainer programs that FEMA developed for offering community-based education on different things like skills recovery and managing stress. And so they've been doing these education programs as well to raise awareness. Now, I want to mention one other thing. To avoid the risk of leaving something out.
Don't do that.
The other piece that we launched in this, being both on faculty at a university, we had to have a research component. And so we did create also a program evaluation team as part of this. And Dr. Sarah Friedman, who is assistant professor in the School of Community Health Sciences, is leading that evaluation team. She's been conducting focus groups and interviews and surveys on each of the different action teams. She has a research assistant student who's working with her, gathering data, and we've started analyzing and have begun to report some of those results as well. So we're trying to really document the impact of this, and we'll see if it's of interest to the peer-reviewed journals. But who cares? I mean, we're gathering this information, and we're going to put it out into the world, and just let people know the story of what we've done over the last year.
It's so helpful, because anytime you're doing, anytime you're working on an initiative, that kind of critical reflection is so important in helping drive future thoughtful action. And so whether it's a formal evaluation or just a regular reflection on how things are going with your partners, that's just a vital part of a good program. So we're really fortunate to work with Dr. Friedman, Dr. Zeb Gibb, and then of course Peter and myself and Casey Acklin and an undergraduate student, Ryan Nolan. We're the evaluation team for Nevada Can, and really looking forward to sharing our data and our program partners' reflections on the effectiveness and impact of these different action teams. So I look forward to that. And I guess I'm just kind of amazed that even during the pandemic and the rapid response, we were able to pull that together. So thank you, Sarah Friedman, for your leadership role with our evaluation team.
One other quick thing I want to mention is that just as a resource, and we shouldn't overlook this, but this work not only was convened and led by the Nevada Aging Disability Services Division because of their passion for what we were doing, but Dena Schmidt was also able to mobilize funding for it as well. And so she was able to bring some of the CARES Act dollars, the Older Americans Act, CARES Act dollars that were coming into the state, and provide us with some grant funding for supporting our leadership and mobilization of this network as well. I'll say there's been quite a bit of in-kind effort in addition to the funding that was provided, but certainly over the last year, that funding has enabled us to sustain these efforts in the future.
So it's always so delightful to talk about what works, right? I'm sure you learned some things that didn't work along the way. And as you know, other people are listening to this, maybe they represent other communities and they're inspired by what you created. What would you want them to know that you wish you had known going in? What were the challenges that, you could have done without, but, chances are you learned from them?
Okay, start on this one. So one of the things we've learned is that elders are really reluctant to ask for help. I don't know if that's a Nevada thing, but or if it's more national. But here all of a sudden we had almost 500,000, in theory, homebound older adults in Nevada. And, back in March and early April, we just imagined that all of those older adults would be staying home and staying safe. And we were really surprised that, some folks felt really comfortable taking risks and, going out in community and meeting their own needs. And that's great. It was their right to make that decision. And I remember in April, Peter and I were, doing our monthly outing to our local grocery store. And I just remember how surprised we were to see this wonderful World War II veteran in his scooter, no mask, in line at the grocery store, buying a pint of ice cream. And we just
and that was it.
Wow, he's really putting his life on the line here for a pint of ice cream. But it's not just a pint of ice cream. I mean, Peter he loves ice cream, so I'm sure he would also take that risk. But we were surprised at how many older adults were taking risks in going out and meeting their own needs, and thought we would have a higher number of Nevadans asking for help. So that was a big surprise for us, is that we didn't have as many initial referrals as we thought we would have.
Yeah, and I'll say, I mean, my background is in public health and aging, but public health. And our purpose in developing this was to reduce elders' risk of exposure to COVID, to give them the tools that they needed to stay home to reduce their risk of exposure. And in all honesty, and this is not a political comment, but in all honesty, the shutdown that took place to reduce risk of COVID was pretty half-baked across our state and probably across the country. And there were a lot of people that just didn't take it seriously. And it was disappointing. And I think that in many reasons, or in many ways, that's a reason why we're sitting here now, a year later, still dealing with a lot of these issues, that we didn't bring the clamp down last April. And people didn't stay home, and they didn't respect that guidance that was being provided, and therefore they didn't take advantage of the tools that we had developed to enable them to stay home, stay safe, and stay connected to all of these resources. So that was certainly one challenge, and one barrier was just our surprise.
It was surprising.
The lack of engagement that.
And a positive surprise was really just the generosity of all of our partners. And I just want to say that if the Nest Collaborative, speaking of the social support component of Nevada Can, if it has been successful, it is because of all of our partner organizations, all of our volunteers, and the people who are program participants who also help us continue to shape our programs and services. They have made it successful. Our partners have brought not just their time, sitting around a virtual table and planning meetings, but they've brought resources from their respective organizations. They've brought their intellectual property and have really said, oh, here we need to train a whole, army of volunteers virtually. Here's some resources that we developed that you could use. You talk about a dream team to work with. It's just incredible. I mean, specifically in thinking about the educational resources that we leveraged with the Nest Collaborative, the Cleveland Clinic, Lou Rubo Center for Brain Health, we wouldn't have the quality training program that we currently have if not for their significant contributions. And the contributions of professionals who serve as volunteer guides of our volunteers who have no experience in providing social support. And now they've joined the Nest Collaborative. And what we've done is create small cohorts, teams of people. So we have these new volunteers, but they're always working with one or two experienced professionals in the field as their guides, who are also volunteers. And so through the generosity of the Nevada Aging and Social Services Network, our initiative has taken off and has become successful, and it just wouldn't be the case without all of their contributions.
This is, go ahead, Peter. Sorry.
Well, I was just going to say another challenge, since you asked about that, is kind of more of a personal challenge. if you will. But
Oh, no.
Jennifer and I, no,
What is he going to say?
Jennifer and I had very busy and borderline overwhelming full-time jobs before COVID hit.
Right, exactly.
And then suddenly we took on the task of convening and mobilizing a statewide response to COVID over Zoom, from our living room and our kitchen. And, the one thing we do is go out of the house and go for walks around our neighborhood. And we would honestly ask ourselves, a week into this, a month into this, 2 months into this, like, why in God's name did we do this? Like, we could have easily not done this and just like kept our heads down and done our regular day job, and nobody would have said a word. And, we would have had a much better balance in our lives as a result. But
No.
we couldn't. You can't stand on the sidelines when there's a crisis of this magnitude. I mean, as Jennifer said, she's been in the field 30 years. I've been working since 95. So what's that, 25 years as public health gerontologists. So when it comes to public health and aging, this last year has been bar none the biggest kind of emergency crisis of our careers. Hopefully it will stand as the biggest emergency crisis of our entire careers, even moving forward. That there won't be something else that comes a few years from now. But I think, we had to jump in and do something to address what at least last March we saw as a crisis of all elders becoming homebound overnight, and knowing the challenges, that homebound elders typically experience, were now going to be present in all elders' lives. We had to do something. And so we
so glad you did
ourselves for that.
Thanks to Al Power, by the way. We had to we were writing a book, and it was our plan to have our book published by this point, but the pandemic, I think,
he was willing to sacrifice. Yes.
So, but we'll get back to that. We're back to it now. So.
Yeah.
All good news.
Our regular jobs didn't go away. I mean, this was all just kind of layered on top of it.
Yeah.
I still had to serve as a board member for the Eden Alternative.
Thank goodness. What would we have done, considering we needed you?
Last year.
So there's a question that I didn't have a chance to ask earlier, and I'm so glad that Laura Olinger has kind of raised a flare to get our attention on this, because it is a really interesting question. Did you do a widespread distribution of tablets and training to use them? You alluded to the fact that there was some support with technology. We just didn't unpack it. Maybe just a quick response on that, because I know I have something really important I want to ask you before we close today, and we are getting close to closing time. But what could you offer us on this, just for a moment?
Yeah, so there were some of our partners who were able to get grants to purchase,
tablets.
2,000-3,000
Kindle
Fires, tablets, and distribute those. We also they were able to give us some of those, I think 15 of those tablets for us to use as loaners for our telehealth services. But technology has continued to be a barrier. It's not just the tablet, it's also a lot of folks.
Internet service.
A lot of folks, if you give them a tablet and they've never held a tablet before,
yeah,
A, they have to have internet service, but B, they're looking at it going, well, okay, now what do I do? There are a lot of challenges in enabling people to get connected via this technology. But one of the things that Jennifer's team did was put together what they called tech assistants. So it was virtual technical assistants to help give people basically real-time education on how to use those tools.
We keep the same volunteer with the same program participant, and we start over the telephone and then gradually progress to the internet to help that person learn how to master the technology that they're interested in using. And so that's really important. So in addition to having the hardware, the actual tablets, we've been providing internet service. Well, not we, but our partners have been providing scholarships for a year's worth of Wi-Fi or data. And then we're providing the tech support, volunteer assistance as well, kind of the three legs of the stool that you need in order to get online and do anything.
One other quick point on that, just from the telehealth services side, So we did have our folks, our tech folks, give real-time assistance in advance of the appointments so that there weren't hiccups during the actual telehealth visit that was taking place. But we also found that a lot of people just didn't want to do it over telemedicine at all. They wanted to come into the clinic. So we launched what we called reverse telemedicine, which enabled the elder to come into our clinic and sit by themselves in a room and use our technology while our providers zoomed in from the remote locations.
Oh, so interesting. Clever solution. I know sometimes it's about the psychology of it, right? I know. Love it. Thank you for that response. And, the last question I want to ask you feels like a really important one, because obviously when you have done what you've done to make something really powerful happen, you want to see it live on. You want to see it have impact on other communities and other states. And so, bearing in mind that you mentioned earlier that this is already being integrated into Nevada as a long-term solution, not just a crisis response, but actually a new way of being and working together. How can other communities and states that might be inspired by what you shared today, how could they get engaged and learn from you?
Do you want to tell them about the plan?
Yeah,
that
so
they posted?
I mean, we did release last March. Again, everything seemed to happen a year ago. But we did release a resource guide for states and communities that included our program plan, along with some letters kind of describing the context and how it evolved. And so that is available. And we can share that, Laura, with you and the Eden team to distribute as well. And it outlines what we did and how we did it, and structurally how it was built. I would say, there probably are very few groups that could just take that and replicate it. It's not an off-the-shelf document that you take and implement, like a Utah can or a Mississippi can. But there may be just some ideas in there that people could glean in thinking about how they're convening their partners around setting a clear set of objectives that all of those partners will work towards. And I think that's the heart of it, right? Is that it was a statewide collaboration, bringing together all of the different service organizations and saying, okay, what are the top priorities? We can't continue doing everything for everyone and all these wonderful things that we've been doing that people need in sort of normal times, as we say now. But what are the critical priorities for this emergency situation? And so convening those partners to identify those priorities and then working collectively towards achieving them, I think really is at the heart of this. It's all about relationships and prioritization. And then having an easy way, as Jennifer talked about, for elders to tell you what they need so that it's a self-determined approach.
In addition, and I'll speak on behalf of the NEST Collaborative, that any of the materials that we have developed, we want to share freely with any group or organization or state who's interested. And if folks just email us, it's really easy. It's social support, all one word, social support @unr.edu. If you want to have a copy of our materials, if you want to hear about our plan or schedule a time to talk to our team, and we'd be happy to share our information. It was collaboratively developed. It doesn't belong to any one person or organization. It's a reflection of our amazing coalition, and we want to share that work with anyone who's interested. So just let us know how we can help. We're eager to expand our partnerships beyond the borders of the state of Nevada.
Beautiful. And so, since I see we're just 2 minutes off from needing to close, I just want to take this moment to say this was a delight. For a year, I've been hoping to have this conversation. I remember saying to both of you, one of you, we got to get you on the live show. This is too important. And I am so glad that that was possible. Thank you for making the time for us. I will just add, I love that Meredith put up the email address for you. But if folks are interested in the plan, the PDF plan, I found it very quickly just by Googling Nevada CAN rapid response, and poof, it was, I think, the first thing at the top, a PDF that you can download that's specific to examples for states about what they can do, how they can try some of the things that you did. Don't know how to say thanks, except thank you. It was so much fun.
Thank you.
Yeah, thank you so much, Laura. And also thanks to the entire team at Eden, and thanks to everyone on this call for all of your hard work over the last year. I mean, we're just the ones who were invited to have this opportunity to share what we've done, but we know very well that we're not the only people out there working really hard to make a difference during this time, but that so many thousands of people in our world of aging have been doing everything they can to support elders over the last year. And I'm just really grateful for the